Hello, I'm Dr. Robert Durkin of Kapiolani Medical Center for Women and Children. When someone close to you suffers a serious injury or requires special medical attention, it can be difficult to bear, and even harder when that person is your child. While waiting for your child to be diagnosed, parents often fear the worst. That's only natural. The fear gives way to hope and relief once your doctor has explained the many treatment options available for your child. If the treatment plan includes a Spica cast, there are some things you will need to know. That's why we created this video, for you and your family. The following sections of information will help you to understand the basics of the Spica cast and how to care for your child while they are in one. They are 1. Applying the Spica cast, 2. Getting around, 3. Daily routines, 4. Staying active, 5. Using the toilet, 6. Cast care and cleaning, and 7. Checking for warning signs. Injuries and other conditions requiring surgery happen to our kids, but fortunately children are resilient. With the proper care, your child's broken bones will heal. A Spica cast will play an important role in their recovery, and so will you. Why do we need the Spica cast? Certain fractures and operations require that the hip joint be kept still for proper healing. The body or Spica cast is applied to protect and support the affected area for extended periods of time. The cast is typically worn for 6 to 12 weeks. The body Spica cast works by immobilizing the leg or legs to the trunk by crossing the hip and pelvis with a specially applied cast. Spicas are lightweight yet very strong. They are specially padded and lined to keep your child comfortable. Receiving a Spica cast is a relatively quick and painless procedure. Often casts are applied shortly after surgery while your child is still sedated. The process takes less than an hour. First, a special Gore-Tex liner is pulled over the skin. This body liner helps to keep the skin clean and dry even if you sweat. It is the only part of the cast meant to directly contact the skin. It is like a body stocking. Next, a special synthetic lining is wrapped over the liner to pad the bones and joints and to prevent chafing. During the weeks to come, this lining will keep the young patient comfortable. It must be kept clean, dry, and intact. Finally, a damp fiberglass bandage is applied to the legs, hip, and trunk. The fiberglass material is similar to that used to make surfboards and boats, but our fiberglass is water activated, so you shouldn't notice any smell. If needed, a support bar is placed between the legs to brace the cast. The bar adds strength without much additional weight. It is not a handle, or to be used when moving your child. The fiberglass cast will dry quickly, in just 10 to 20 minutes. It may be a little warm at first, so while the cast dries, it should be left uncovered and allowed to air cool. To make your child more comfortable, you may use a breathable cotton-covered pillow to prop up their legs. If you find any rough edges, or if any develop later that irritate your child, you may cover them with common moleskin bandages, found at most drugstores. Begin by cutting the moleskin into 3-inch strips, rounding the edges until they look something like a Band-Aid. With the sticky side down, attach one end of the strip to the inner lining of the cast. Then fold the moleskin over and smooth it down over the outer edge of the cast. Apply just enough pressure to ensure a good adhesive grip. You can add more moleskin from time to time if it becomes loose. With infant casts, some parents prefer to place moleskin around the groin area to help keep the Spica clean during diapering. However, moleskin adhesive can tear the inner cast lining if applied too frequently. It is best to use them sparingly. That's all there is to it. Once the cast is dry and your child is safe, your doctor will let you know that it's okay for them to return home. Spica casts vary from case to case, and so do the mobility needs of the children who wear them. Your doctor may prescribe the use of crutches, wheelchairs, car safety harnesses, and other devices to properly move the young Spica cast patient. Reclining wheelchairs are often the best way for older, heavier children to travel, especially those who are able to attend school. Traveling by car, however, requires careful preparation. On the road, one of the most important pieces of equipment you will need is a special type of seatbelt, or a car seat that's able to accommodate the Spica cast. Kapiolani Therapy Services assists families in finding and using the appropriate device for your child and your car. Your therapist will train you in the proper use of any equipment. Whichever device you use, make sure you read all the installation instructions carefully. With a little assistance and practice, you will soon be able to safely transport your child back home and to any other places they may need to go. Learning to get around will be just one of many changes to you and your child's daily routine. Your family will need to make some minor adjustments as you transition from professional care in the hospital setting to living with a Spica cast at home. As your child returns home, we encourage you as much as possible to keep to their normal routine. This may even include returning to school. You'll soon realize that your child's normal clothes may not fit over the bulky Spica cast. Special clothing is often required to provide modesty and convenience. You may want to prepare a few of these garments for your child before they leave the hospital. For girls, oversized shirts and dresses are popular choices. For boys and girls, baggy shorts with stretchable waistlines sometimes work. You can also cut shorts along the groin seams or the sides, then hold them closed with Velcro or pins. At home, your child will spend most of their time lying in bed or propped on a couch. Depending on their type of Spica cast, they might be able to spend time in a wheelchair, beanbag, or stroller. While they are resting, you'll need to ensure proper blood supply to the injured areas. It is very important to shift your child's position every 2 hours or less. Get into the habit of moving them regularly. Failing to do this can result in poor circulation, painful bed sores, and the possibility of a serious infection inside the Spica. These conditions could slow their recovery or even require removal of the cast. You don't want this to happen. And remember, never use the bar between the legs to support your child or move them around. That bar might break, causing them injury or damaging the cast. You don't want to start this process all over again. Even when they are asleep at night, you should get up and turn your child at least once. Try to make your child as safe and comfortable as possible. If you have an infant, check them frequently. When your child is lying on his or her back, use pillows to prop the head, neck, and shoulders. To keep pressure off the heels, you can position a small pillow or roll up a soft towel under your child's leg until the heels hang freely. And keep the sides of the crib up at all times. If your child prefers to lie face down, their legs should dangle freely from a pillow or over the edge of the bed to keep pressure off the toes. Pillows placed under the head and chest help keep your child stable and comfortable. Pay special attention to playtime. It's an important part of your child's day and you should encourage it. However, don't allow them to play with any small toys that could fall into the cast and cause problems. In fact, objects should never be inserted into the Spica cast. This includes toys, chopsticks, or pencils that your child may have within reach. Scratches inside the cast can go unnoticed until they become infected. Encourage your youngster to read, watch TV, play games, practice music, paint, solve puzzles, or stay in touch with their friends. Together you can find countless ways to pass the time and keep your child's mind active.
How's your cast in the back? You okay?
As your child's activity level changes, their appetite may change as well. You will need to monitor their eating habits for a while. Some kids develop the urge to eat more frequently simply because they are bored. Keeping them active, or better yet, spending time with them helps curb this habit. Others seem to lose their appetites, especially when the Spica cast is new. As usual, it's important that your child drinks lots of fluids and eats a well-balanced diet. Serving them high-fiber foods like fruits and vegetables helps prevent constipation. Your child may be more comfortable with smaller, more frequent meals or snacks rather than a few heavy meals. These are easier to digest. Unless your doctor prescribes them, vitamins and mineral supplements like calcium are not needed. We recommend using a bib, a towel, or a long t-shirt to keep liquids and food crumbs where they belong, outside the cast. Mastering your child's toilet routine in a Spica cast can be one of the biggest challenges you'll face, but it's very important. To aid you, we leave the groin and rectal areas of the cast exposed. Concentrate on keeping those areas both clean and dry, and you'll avoid problems like rashes and odors. If you attend to your child's toilet needs quickly and properly, the time spent in a Spica cast will be much easier for all concerned. Naturally, it helps a bit if your child is potty trained. But for infants and untrained toddlers in a Spica body cast, there is a simple two-step diapering technique. Two-step diapering involves placing a smaller diaper inside the Spica cast and a second, larger one around the cast to provide dual layers of protection. You begin by placing the smaller diaper completely inside the cast opening, with the absorbent side in contact with your baby's skin. Some parents prefer to use preemie diapers, sanitary napkins, or bladder control pads for this layer. You can trim these first as needed for a proper fit. Avoid wedging them inside too tightly, as this could cause pinching of the skin. Once the inner diaper or pad is fully tucked under the edges of the cast, apply the larger outer diaper around the cast as you normally would, and tape the diaper in place. Finally, tuck the area between the legs into the cast as well to prevent leaks. When it's time to change the soiled diapers, remove them carefully and clean your baby and the Spica with baby wipes. Baby powder should not be used in a Spica cast. Diapers should be changed often before urine is able to leak from the diaper and into the cast. We recommend that you check for wetness every hour. During the night, it's important to change the diapers at least once. Be sure to adjust your child's sleeping position at the same time. Older children may be able to take care of some personal needs by themselves. This is a blessing, but they still may require help transferring to and from the toilet. Be ready to help. Boys can also use urinals. Working with a bedpan will take a more coordinated effort. Your son or daughter may need to be assisted and propped into position with pillows. Keeping your child and their cast clean is a simple task, but a very important one. In order to prevent infection or irritation, you'll need to keep them both clean and dry. The Spica cast needs to remain dry at all times, especially the soft lining next to the skin. But when you clean your child, you can and should clean the outside of the cast as well. All you need is a small amount of soap on a damp cloth that's not too wet. Clean the skin around and just inside the cast. Baby wipes also work well for this. Use care to avoid pulling out pieces of the soft inner lining. It protects your child's skin. Quickly and thoroughly dry the skin with a towel. You can then clean the outside of the Spica in the same manner. Don't use baby powder or bath powders inside the cast. These will mix with sweat and cause irritation. Remember, you want to avoid getting this lining wet. If the lining becomes wet, dry it with a hairdryer set only to cool. It may take up to an hour, but make sure it's completely dry. Never use the hot setting. Heat builds up quickly inside the cast and can result in painful burns. If your child complains of itching inside the cast, a hairdryer set on cool can also provide some relief. Simply direct the cool air inside the closest opening of the cast.
Okay? Is it itchy at all?
Other sources of coolness can also help relieve itching. Try placing an ice pack on the cast near the problem area. To keep the cast dry, make sure the ice pack is completely sealed and wrapped in a towel. If you don't have ice on hand, gently pat the cast where it itches most. Your child can do this too.
Okay, point to where it's itchy. So it itches right here.
Simply changing your child's position often stops the itching as well. You or your child should never stick anything inside the cast to scratch an itch. Inside the Spica, damage to the skin can easily go undetected until infection sets in. Parents should keep a close eye on the general condition of the cast. If the spica becomes damaged, the bone may not heal properly. Sharp or broken edges are also a concern. Should you notice a crack or any other damage, keep the area as still as possible and call your doctor right away. Call your doctor's office if any skin irritation, redness, or rash lasts longer than 2 or 3 days. Throughout the day, you'll want to check for good blood circulation inside the cast. If your child complains that the cast feels tight, or if you can't fit your finger between the cast and the skin, there may be swelling. Swelling, which may lead to poor blood flow under the cast, can be reduced simply by raising the legs and hips up with pillows. There are several ways to test for good circulation. You can use them whenever you change your child's position. Have your child flex their foot and wiggle their toes. Movement without pain is one sign that everything is okay. Also, touch the skin next to the cast. Ask them how it feels. If the area is numb, painful, or tingles, it could mean that there is a problem with the cast. Another test is to press down on a toenail for a moment until it turns white. After releasing it, the pink color should return within 3 seconds. If the toenail still appears white or bluish, consult your doctor. Your role in monitoring your child's condition is very important. If you notice any signs of poor circulation, call your doctor's office right away. We'll be happy to address the problem. After all, the Kapiolani team and your family share the same goal, a healthy, happy child. If you have a question or need advice, please consult your doctor or nurse. And call immediately if you notice any of these warning signs. A broken or damaged cast. A cast that is very wet. A cast that is too tight. Unusual swelling in the toes or in or around the cast. Any loss of movement in the toes. Numbness or tingling that doesn't go away. Changes in skin color above or below the cast. Pain that's new or different than previous discomfort, or pain that doesn't go away when your child changes their position or takes their prescribed medications. Fresh stains on the cast caused by drainage or blood. A foul smell from the cast, or a fever over 101 degrees that lasts more than 24 hours. We understand that there are lots of questions and concerns when you have a child in a Spica cast, but remember, you have the support of a complete medical team behind you. With a little patience and some extra care, bones heal fully and properly. Try to keep your child as clean, active, and comfortable as possible. Before long, the cast will come off and your child will be on the way to a healthier life. Thanks for watching and good luck.